After 3 years of planning, the Mahaska Health Partnership is preparing to break ground on a $22 million new wing. The additional 52,000 square feet will provide breathing room for both patients and the hospital's various departments. For a better look at what the hospital has in store for its new addition, CRI reporter Patrick Boberg sat down with Mahaska Health Partnership CEO Jay Christensen.
It's two-story. It's 52,000 square feet total, 26,000 on each floor. And actually, it's a little bit deceiving. It'll be almost the same height as the existing clinic building that it'll be attached to.
That's Jay Christensen discussing the details of Mahaska Health Partnership's new addition that will be home to all of the hospital's surgery, birthing, and inpatient departments. The new wing should be finished in 2012 and will be built right here. That means that the helipad will need to be moved and the parking lot will have to be reorganized. According to Christensen, the option to renovate what already existed at the hospital was considered, but to provide a more satisfactory healthcare experience to patients and increase surgical capacity, the additional wing seemed necessary.
You want to make it a great place for people to want to be so that we can recruit physicians, so that we can attract patients, and so that we're a facility that our community is as proud of as we are.
At $22 million, the bill for the new wing is not cheap. Some of the funds will come from hospital reserves. However, the lion's share of the bill will be paid through loans.
With interest rates at historic lows, we're going to borrow as much of it as we possibly can because I just don't think there's ever going to be a better time to do that, and I'd rather save our funds for other opportunities. Maybe that would even be new services at that point in time.
A loan means that only those who partake of the hospital's services will be footing the bill.
We're not raising taxes. We're not looking for a capital campaign at this point in time. We just did that to build the hospice house, and so we didn't think that it was the appropriate time to do that for this project.
So with a big new wing, a natural question would be, new jobs?
Maybe. Essentially, we're starting out moving what we already have, but part of that purpose is to be able to recruit additional physicians and specialties to the community. So if you look out at it over a 5 or 10 year period of time, clearly our expectation is that we'll be able to add some jobs. I wouldn't sit here and commit to you that that would be available on the first day we opened it, because I just don't know yet, but certainly that's in our plans down the road.
This will be the largest addition to the hospital in its 100-plus year history. And after receiving approval from the City Council and the Zoning Commission, Mahaska Health Partnership is right on schedule to break ground this July. For CRI Weekly News, I'm Patrick Boberg.